name's Roger Huxley. I'm 67, I think. I'm a patient. And to continue with the football analogy, I'm a Christian and a Birmingham City supporter, so there's plenty of opportunity for prayer. I've sort of titled this, which I think is probably the motto of my career, really. Well, we just got away with it. It all started for me in 2014. I had what I was thinking was a bad year. I'd started off the year with the flu. I then had run-ins with my boss over redevelopment, changing my job. I discovered, or the doctor discovered, I had an enlarged prostate, which is very common in blokes my age, and was about to have some, I don't know, unspeakable intervention with a laser and my tender bits. But I was suffering from what I was like chronic fatigue, so much so that I couldn't walk all the way home. It was only 2 miles without actually stopping. Anyway, I was brought in for a pre-op assessment on New Year's Eve 2014. I struggled home, sitting with my wife, having a cup of tea, trying to decide what to do New Year's Eve, and the phone rang, and it was the hospital saying, "We've discovered something out of order with your blood count. Could you come in on Friday," which was January the 2nd, have another blood test. So I actually had a moment of revelation. I'm thinking, blimey, I've got leukemia, and then that just popped out of my head. So that day you go, and instead of going to where I'd been in the phlebotomy bit, I get ushered up to what transpired to be the chemotherapy suite, and my heart, which is normally a nice steady 50 beats per minute, suddenly quadrupled. And so then I sat down, and there was a Macmillan nurse there. My wife had just dropped me and gone off to Matalan or somewhere. So this news that you have this incurable disease called blah, 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 which everything turned to gibberish. But fortunately, she drew some diagrams and made some notes, had extra blood tests, and then it came back that my red blood count was 87, which probably explains the fatigue and breathlessness. My white blood was 380, and the lymphocytes about 350. So there was no alternative. We then had a weekend where we had to wait. It was actually my birthday, so we tried to bury ourselves away from the family because I just couldn't speak to anybody. My wife at this stage didn't know, and she picked me up full of the joys of new curtains or whatever she'd recklessly bought, and she said, "How was it?" And I couldn't open my mouth. I was just stunned. I said, "We'll have a cup of tea and I'll tell you." And then I remember looking out the back kitchen window and trying to find the words, really. And then, of course, she was upset. Anyway, that week when I managed to avoid my children, because I don't think they were asking for money, they should have been passing some my way. And then we went back, had a bone marrow biopsy, which is everything that they tell you, with 2 young, attractive medical students in attendance. And then it was all confirmed, and I collected my drugs and was sent home. And then I realised when I got home, I got to tell my employer that I've been signed off for a few weeks with this incurable cancer. Well, we did that. We took the drugs, and everything seemed fine for a couple of weeks. First cycle of chemo was a dream. I thought this would be okay. And then we had the bombshell. We had let's say the actual prognostic markers were not good and chemotherapy wasn't going to work. We're referring you to the University College Hospital, which meant then another wait of 3 or 4 weeks till we got an appointment. So the old nerves are going. I'd have liked to have hit the bottle or something. I sort of shook my fist heavenwards, didn't get any answer. Yeah, so we continued. Once we got to the University College Hospital, it's a fantastic place. It's like a spaceship. We didn't actually see the professor, but we saw one of his sidekicks, and he said, no, they've misinterpreted your the cytogenics, is it? Somebody will correct me maybe. No, you've got an ATM gene deletion and 11q or 13q or perhaps both. Chemotherapy will work. And I got sent back to Luton and I was relatively happy. But of course, we then had to join the queue again. So which time it was Easter, by which time I should have been pretty much halfway through, where I was only just starting the second phase. Anyway, I'll cut through all the stuff because I want to be encouraging. We got through to November and finished the 6 cycles, and they said, oh, you're in remission. And I asked, are you going to actually tell me whether it's a good remission? And he said, well, no, we're not, the blood counts seem okay, you'll be fine. But I was probably pretty depressed then, and I was experiencing muscle wastage, I think is probably the best way, because I hadn't done very much for that 10 months. Anyway, everything seemed fine. I had a bit of knee pain. I went in 2016. My wife decided, well, actually she wasn't my wife then. She thought it'd be a good idea to marry me. We'd been together about 13, 14 years. So May the 1st, we had a beautiful day and managed to get all my family, or both families, together without fighting. No blood was shed. We decided we'd have a booze-free do, and it was fantastic. We had a little holiday and we did some work on the house, and I felt okay for most of that year. And then in February last year, I finally engaged with the orthopedic department with my knees, and I had an arthroscopy, but I didn't tell them that I hadn't had a pee, so they sent me out. Anyway, within about 48 hours, I was taken into A&E because I got acute urinary retention, and I'll spare you the biology, but Dr. Tom was a wonder with the catheter, and which I then had to wear for another 2 months. But everything in that direction was fine. And then in the summer of 2017, I began, those of you reckless ones like me will perhaps have experienced a hangover. Well, it was like living with a hangover every day. My head was pumping, again the breathlessness, and then this large lump appeared on my neck, and the blood counts were going up, going in the wrong direction again. And then unfortunately my mother died, but she'd had a sort of pretty acute dementia, profound dementia for a great number of years. So we had a bit of a month of getting ready and going through the funeral and all that family business. And I think the adrenaline carried me through, but once we laid her to rest and everything calmed down, I caved in and was again diagnosed, or we'll send you for a bone marrow, we'll give you a CT scan again, and another bone marrow biopsy. And that came back eventually as 75% infiltrated. The lump was causing me problem, the ones in my groin were causing problem, and I don't know what you call it, the little bobbly bone between your, behind your diaphragm was sort of sticking out. and they said it's the lymph nodes are swollen behind it, and we need to do something. And they suggested I bruise it. I thought they were going to say chemotherapy because I was still okay, you know, fairly young and fit. And they said, oh no, we go for ibrutinib. So on December the 2nd, I started that. And I have to say, I'm into the 4th month, I do feel like a new person. The breathlessness has gone. The lymph nodes have gone. My knees are still dodgy. And I've put on a bit of, the corporation is sitting. I'm more active. Anyway, so yeah, so ibrutinib is working. But one very positive thing, in I don't know, March 2016, we attended one of these conferences in Nottingham, and it changed my whole perspective. I'd never known anybody with CLL. I didn't know about CLL, only what I'd researched. And I sat with people a lot of people hadn't had treatment, and they were fine. People had had treatment, and they looked fine. There were no people in hospital beds in the conference or walking around with drips. Everybody seemed quite normal and friendly. And we chatted and shared stories. And on the way home, on the train home, it's fantastic. Which then, because of my, I suppose, one of my core values is providing support to people, is I thought, when I get a bit better, I'm going to have a go at helping this organisation. And I think sometime in the summer, last summer, I put myself forward as a trustee. Recklessly, again, they sort of thought I was okay and thought perhaps some of my work experience, not the catering part of my career, which I haven't told you about, but my work within the voluntary sector with Headway and Mind. Anyway, so what lies ahead? What advice can I give you? You've had some good advice from Dennis. Keep your brain active, do something, engage with people, eat well, don't isolate yourself, try and learn something new, and train yourself not to think about CLL. I did a mental health first aid course, and they gave us some tips on mindfulness. That has really helped me. I do some yoga, but I don't necessarily recommend that. So even though the disease has come back, I still think I've been pretty lucky. And I've been pretty lucky to meet people and to be involved. So I've gone from being absolutely overwhelmed with CLL, like walking into a door or something, to now there are days when I don't think about it. I take the tablets when my wife tells me, and they are working. How long for? I don't know. I'm not worried now. I've managed to get my state pension, so that's something which makes us happy. And we live each day as it's going to be a good day. So thank you. Thank you.